Hello, everyone, and welcome to another episode of Dr. Gilbert Hosts. Whether it's your first time tuning in or you're a regular, please say hi and let us know where you're joining us from today. So, thank you very much for being here and to join us in discussing an extremely important topic, which is clinical trials. As everyone would agree, clinical trials are essential for advancing Parkinson's disease research. And we also know that recruiting participants, especially a diverse group of people that reflect people of different races and ethnicities, remains a very significant challenge. So, on this special episode of Dr. Gilbert Hosts, we're going to explore this important issue and we're going to highlight an inspiring initiative which is designed to encourage, inform, and educate people with Parkinson's about the clinical trial process, with a particular focus on communities that in recent history have been underrepresented in research studies. Now, this multifaceted initiative includes the book, PD Movers, We Participate in Research, and the documentary Credible Messenger. And these feature community-authored stories about research participation. Now, this initiative is an extension of PD Movers, We Keep Moving, a powerful compilation of narratives from Black and African American individuals living and thriving with Parkinson's. The current initiative also includes education discussion guides and culturally sensitive resource materials to support engagement and understanding around clinical trials. Our broadcast today is going to feature four individuals who are co-creators of these resources. They are Bernard Coley, Denise Coley, Anita Parker, and Dr. Haral Shah. The audience may recall that 3 years ago, we had a broadcast in which we discussed the original PD Movers book, and so we're very excited to have everyone back to continue that conversation. So to start our discussion, Bernard and Denise Coley will present the project, and it will include a 6-minute trailer from their documentary, Credible Messenger, and then we'll have a Q&A with our four participants. So I now will formally introduce each of our guests to you today. First off is Denise Coley. She is the founder and co-managing partner of Enable Your Vision, which is a firm that provides supplier diversity consulting to drive economic vitality for diverse businesses, corporations, and the communities in which they reside. Denise has been diagnosed with Parkinson's, and since then, she's been using her talents and time to improve the lives of individuals and families impacted by Parkinson's and the health disparities associated with Parkinson's. She co-chairs with her husband, Bernard, the special interest group, Black Diaspora, focusing on closing health disparities in underengaged communities, educating health resources and research organizations and how to better engage these communities in a culturally sensitive manner, bringing Black patient advocacy perspectives to PD research, and increasing Black community participation in clinical research studies. Next up is Bernard Coley. He's an executive with 50+ years of experience in high tech, and in addition has a lengthy career of volunteer work, including community development projects supporting the arts, youth development, business leadership, and facilitating and mentoring entrepreneurial development in underserved and Indigenous communities. Since Bernard's work, Denise was diagnosed with Parkinson's, Bernard has been aiming his talents and time to improve the lives of those impacted by Parkinson's and works alongside Denise on all of the special interest group Black Diaspora initiatives. Now, Mr. Coley is passionate about patient voice inclusion and serves on patient advocacy councils with national and international pharmaceutical companies. He especially enjoys his work as the patient voice in a multidisciplinary industry team, developing and maintaining a plain language glossary of clinical research terms. Next is Miss Anita Parker. She's a licensed social worker and serves as the Community Outreach Director of St. Luke AME Church in New York City. She's a community partner to the research team and a staunch advocate for bringing resources to New York City's Black and Hispanic communities. And finally, Dr. Haral Shah. She's an assistant professor of neurology at Columbia University Irving Medical Center in the Division of Movement Disorders and the medical director of the Parkinson's Foundation Center of Excellence. She's committed to learning how to identify, address, and overcome barriers of stigma and discrimination to improve care access and provide holistic solutions for those with neurodegenerative disorders. Welcome, everyone. I now invite Bernard and Denise to share with us their new initiative to move the needle on participation of underengaged communities in clinical trials. So let's start with this question. Bernard and Denise, why did you turn to focus on clinical trial participation after the original PD Movers book. Bernard and Denise, the floor is yours.
Well, on behalf of all of us, thank you for hosting this panel, Dr. Gilbert and ADPA. We really appreciate this opportunity to lift up this set of issues. This is actually an excellent question to start with. At the formation of Special Interest Group Black Diaspora, a community-led association that we founded to address the community within the Black Parkinson's disease community on not just health equity, but also brain health in general, because we kept encountering individuals in our community who thought they were the only one, including us. So we established three pillars: raising awareness of PD in the Black community and in other underengaged communities, inclusion of the Black Parkinson's disease community in clinical research as patients and researchers, and highlighting the Black community's participation in finding solutions, better treatments, and a cure. So when the opportunity to participate in the first PD Movers book came along, it was a perfect next step for us. We had been working on a learning institute with another organization, developing a culturally sensitive, Black focused one, focused on research. And it raised some very obvious challenges. So when this opportunity came up with Dr. Shaw and Mrs. Parker, they had developed a great framework around using culturally sensitive storytelling to raise awareness of Parkinson's disease in the Black community. And it was very hard, where it's very hard to motivate the Black community to participate in research if they're not aware that we are included in the disease community. So PD Movers, We Keep Moving was an excellent and well-curated tool for raising awareness of PD in the Black community and outside the Black community. However, the challenge of low inclusion of the Black community in major PD research remains. Denise?
So we returned the critical issue of increasing underengaged communities in clinical research and clinical trials. We again focused on using storytelling to convey the lived experience of members of the Black community. Participating in or attempting to participate in clinical research, hence the completion of the Credible Messenger documentary and the companion PD Movers We Participate in Research book. In collaboration with the PD Movers team and an assembled group of thought leaders in the PD community. Let's look at the documentary trailer. Thank you.
Okay. Hi, Kermit. How are you today?
Pretty good. How are you?
I'm doing just fine. Kermit, I was thinking, I had a question for you. Have you ever participated in a clinical research trial?
No, no, no. I have not.
Hello, I am Robert Bernard Coley, a PD mover, and I am a PD research advocate. If you are wondering what that is, then follow me along on this journey as I share my clinical research participation challenge insights and those of my fellow PD movers.
Why is the patient care partner voice so important for PD clinical research, recruitment, participation, and retention?
The goal is really, to find ways to improve the quality of life of those living with Parkinson's, whether by finding a cure or finding a novel treatment, or even finding new ways to live and cope with the disease. But if we don't consider the voices, the experiences, that real life experience of people living with Parkinson's, I think we're going to miss the mark.
If I had a magic wand and I could wave it and put a bunch of researchers in the room, what would you tell them? What do you think the most important thing that you can take from your experience to tell them? What do they need to know?
They need to know a little bit about our history before they come into our community. They needed to have done their research on our community.
What follows now is first-person experiences seeking to participate or experiences from participating in clinical research trials. I hope you will value my fellow storytellers and learn from us. And now, our stories.
The process was so frustrating because of all the roadblocks I experienced at every turn. They told me I was too young. I was diagnosed with early onset at age 38. They said that they wanted newly diagnosed, but I had Parkinson's for 5 years. They told me I couldn't be on meds yet, but I had been on them since soon after I had been diagnosed. Why was the clinician asking me to sit still? He knew I had Parkinson's and was there to take part in this clinical trial.
Richard's physical therapist referred him to a dancing and drumming study. That was our entry point into research. From that one experience came more.
That study didn't just get me moving, it brought my spirit back to life.
Parkinson's taken so much, but this I know. I have Parkinson's, but it will not have me.
Plus, we understood the importance of having African Americans represented in research. But I was rejected, not just once, but a number of times.
At this moment, I started to realize how dependent I am on my medication. I need it.
Why on earth do I have to drive at least an extra 2 to 3 hours if Denise and I are in the same study, just at 2 different institutions?
All it would take is to be nice and respectful. Ask me how I am. Ask me what I do. But whatever you do, don't ask me to sit still.
When every community has a seat at the research table, the path to a cure belongs to all of us.
The more people see and hear folks that they can relate to talking about this disease, maybe the more people who look like us will decide to take part in research.
We didn't hesitate when asked to participate by the physician conducting the study. If participating in the study would help anyone with PD, then it was worth it. We both realized and agreed that the game was too important to sit on the sidelines.
If we can't listen to each other, why are we here?
We, PD Movers, invite you to sit down and have a conversation with us. Thank you.
Thank you so much for that beautiful trailer. I just wanted to highlight that the full documentary, Credible Messenger, will be premiered in its entirety at World Parkinson Congress, which is coming up next week. So I wanted to thank Bernard and Denise for their presentation and for their video. And we now invite all 4 panelists to our broadcast for our Q&A. And also up on our screen now is the cover of the PD Movers We Participate in Research book. So you can see what it looks like. And so we will start with our Q&A. I will address our first question to Denise. Denise, tell our audience, why is it so important? It was of course discussed a little bit in the trailer, but let's flesh it out a little bit. Why is it so important scientifically to include members of various ethnic backgrounds in the clinical trial process?
Well, it's really important for them to understand the importance by looking at diverse ethnic backgrounds is vital to ensure scientific accuracy because different ancestries process drugs differently. Without broad representation, medical data remains incomplete, which can lead to treatments that are less effective or cause severe hidden side effects in specific populations. And personally, when I have a drug, I always slowly tertiary it up because I don't know what the effects are going to be. And by doing that, I can have more of a tolerance. But if you know ahead of time, you will find that unnecessary.
I'd like to now address Dr. Shah and ask her a question. Many people think about clinical trials, maybe investigated, look for something online, and then are told no and don't really actually enter a clinical trial. What are some of those obstacles that people face, and what are some suggestions to try to overcome those obstacles?
Thank you so much, Rebecca, for this question. Excuse me, battling a little bit of a cold, but before I answer that question, I realized I wanted to just also echo some of what Bernard had said earlier. When we started to do the PD Movers work, I think one of the reasons that we decided to utilize this approach of storytelling is that I had spent a lot of time with Miss Parker in the church, and we were doing brain health presentations. And as we did these presentations and listened to the community, we would hear people spontaneously share their stories. And we saw this approach of delivering testimony as a great way to share and create this sense of connection and that I'm not alone in this struggle. I remember people sharing, when I went to the hospital or when my family member had a stroke. So that concept of sharing one's story being a way to create connection and shared one's lived experience is really powerful. And I think with Credible Messenger and the book, what it highlights is some of the challenges, as you all just heard, like for instance, Michael Fitz expressing that he didn't fit within the inclusion criteria by age. So some of the challenges that I'm seeing when patients or individuals in the clinic are thinking about clinical trials, number one is first being aware that it's even an option. Not everyone is thinking about research because they're still on this battle or journey of acceptance. So that's the first hurdle, is when you're living with Parkinson's, for every person tuning in today, I imagine there's tens or hundreds that aren't listening because they're still grappling with the diagnosis and thinking about how the tremors or their change in mobility or even maybe their change in speech is affecting how they navigate life with their loved ones and families, or even in their community. Maybe they're more worried about how people perceive them and just living with and accepting that they have Parkinson's. So I would say that's the first obstacle. Second is awareness of what research is. Honestly, I asked my mom this question a couple of years ago, even though I work day to day in research, like, Mom, what do you think it means to do clinical research? She's like, I have no idea. And she's a very educated person, but yet, research isn't top of mind to most people who are living their day to day lives. They're not thinking about what research means. Yet, I think when you ask individuals in the community, and as they learn more about any condition, and in this case, Parkinson's, people are very motivated to know, well, what can I do to change this? Like, what can we do to make this better? And if we introduce the concept of research as a systematic way that scientists and medical professionals are trying to understand conditions and identify solutions, oh, that makes sense. So I think we have to really start by educating the community about what research is and what it's not. Research can be a lot of different things. It could mean simply sharing your experience, your lived experience. You are an expert in yourself. So I tell my patients all the time that are living with Parkinson's, you are the experts. By telling us what's happening with you, you're sharing a valuable piece of information. And then, of course, there's structural issues. So, for instance, in this video, we heard from Michael about age. So sometimes there are things within clinical trials that limit who can participate. And sometimes the scientists have very good reasons for this. They want to create a population that's very homogeneous so that we can really understand, does this intervention make a difference or not? But sometimes I do think that we as scientists don't know what we don't know. So we don't realize that by saying that someone can't be on a medicine to help with claustrophobia, suddenly we've excluded anyone that struggles with claustrophobia and can't do an MRI that's a part of the study. So sometimes there's things that are about where someone is with their journey and their disease, and then there's also structural issues. I hope that answers your question, Rebecca.
That's absolutely fantastic. And to a follow-up question, we have a question from our audience from Joseph. And maybe you could jump on this one. I have a pacemaker and been rejected from 2 studies because of it. Should I continue to look for trials? What advice do you have for Joseph?
That's a great question, Joseph. And I would say, first of all, thank you for, putting your time and your effort into participating in research. So I absolutely think you should continue to look for trials and recognize that every trial is different. The fact that you've been rejected from 2 studies, I want to make 2 comments. That tells me that you also are persevere. You have that perseverance, that you're not going to give up, which is such a powerful quality. So thank you for spending your time. And I would say absolutely keep looking for trials. But the second thing I want to remind everyone is that Joseph used that word rejection. And this was something that I learned through this project, is the idea of respectful rejection. I think we as researchers and clinicians need to remember that when we tell someone that they're not a candidate for this particular study or trial, they may actually feel rejected. And that is not a feeling that is a good one. So we want to encourage people and be respectful as they may not qualify, which does not mean you're rejected from all research, but simply that for those particular studies, having a pacemaker may not be safe for you to participate, which is probably why they don't want you to be involved, is they don't want to expose you to unnecessary risks. But if you are committed to contributing in this way to the Parkinson's community, I applaud you and encourage you to keep looking. So thank you for the question.
That is a fantastic answer. I wanted to add one additional thing is that we should probably highlight is that clinical trials is a very broad category of trials. So you can have a trial where you're taking a medication, for example, or a trial where someone's putting a wire in your brain. But there are also clinical trials that are called observational trials that really just asking for information about you, maybe following you over time with pieces of information as your disease progresses. And that's super, super important too. And those trials would be more open to people that may have other medical conditions. So maybe that's something to discuss with your doctor as well, how to participate in that type of clinical trial. We have a question from Karen that I think would be a great question for Ms. Parker to answer. So there's a lot of information that the PD Movers, We Participate in Research guide is collecting, and it's a lot of great information. But how does somebody who is involved in a support group, for example, who may have encountered hesitancy in clinical trials, or just sort of a general sense that, oh, this isn't for me, how do you convey that information to a support group?
You meet the person and work with them to explain to them the different types of support groups that there are. Sometimes you have to start one-on-one for them to feel comfortable with you, because this is a big step for them to be able to talk about this to someone one-on-one who's not in the clinical setting far as a hospital. So when they meet you, they want to feel comfortable. You have to make them feel comfortable and talk about the group, talk about how the different groups that are available. And it makes a difference. And they see your genuineness. People see how you react to them, how you talk to them. It's important they feel that trust that you as the facilitator to be able to make them feel comfortable in the group. You're sitting, the group is running, but you set some guidelines, but they watch your movements. And I feel that has brought a lot of participants to one-on-one therapy and group discussions because it's important that trust, because you're like the receptionist who come into when you come into the clinic. How you treat that patient or person when they walk in makes a big difference of what
Fantastic.
they're going to receive.
Thank you. Thank you so much. I think Dr. Shah and Denise would like to answer that question as well. So Dr. Shah.
Yeah, I want to thank Karen, and jumping off of what Ms. Parker stated about trust, the other thing that I would suggest is meeting the person where they are. So by first asking them, or if you sense that they're hesitant, you might just start with an open-ended question like, are you familiar with research? Or what do you know about research? Because it could be that the hesitancy is rooted in a misconception or a worry, and we could address that. I think the first step is then the education. But next, I would also encourage everyone that the goal of this webinar and our resources also not to make or encourage everyone to participate in research. It may not be the right thing for everyone. I always tell Ms. Parker and my colleagues that my goal is for everyone to have the choice. So if people not have the information and then they're still hesitant, I think we would leave it to them. And it reminds me of the trainings about like people where they are in terms of their readiness for change. Are they pre-contemplative? They've never even heard about research. Are they thinking about it? They're contemplative, or maybe they find that, oh, it's too overwhelming. It's too much work. I'm not going to find a clinical trial anyways. But I think by starting by meeting the person where they are and understanding where the hesitancy is coming from, that's a great place to start. But this is also where we have to plug the book, the PD Movers. We participate in research. You can certainly hand that to someone. And then when that individual is ready, they can take a look at it, they can read it, they can be part of it. And then that might help you start that conversation. It might actually create some curiosity and questions, but presenting the information in this way allows that person to take it in their own time and digest the information. So I'll pass it on to Denise.
Thank you, Dr. Shaw. Great answer. What I'd like to have everyone think about is first ask why you're interested in research and have a dialogue with the researcher or the doctor that you're talking to about the importance of research. And remember, research is just not clinical, it's observational. So when I see people, I said, I'm sending people to participate in research because they're interested, but we had the conversation about observational first. The first studies that I did were studies, things where you can answer surveys. And then I went to wearables and I did a few other things just so I could have my feet wet and answer any questions that people had about participation and why it was important that we participate in it. And then I moved over to the clinical research in later years because I had a fear of needles and I didn't want anything that was more intrusive. But each person has to look at why it's important to them, what they're looking at. And if you're just wanting to get started, start on the observational side so you can get a look at what is expected, how long it will take, and what are the expectations. And one of the best things that people always say about participating in research is, I had an opportunity to make a difference, or I had an opportunity to have access to medication or doctors or hospitals that I would not have had. So those are the things that are in the book in different spots, but those are what the community thinks about it.
Fantastic. That's all a fantastic information, a lot for people to think about who may have been hesitant before. Thank you so much for that. As a follow-up question to that, so Denise, you went through sort of your trajectory. You did the observational, and then kind of did the wearables, then did an actual drug, I'm assuming. Was that the third?
Yes.
And I know that Bernard, you were also participated in clinical trials as a as a foil to people who do have Parkinson's. Could you tell us a little bit about what your participation was like in clinical trials?
So I'd love to, but just before I answer that question, let me pivot for a second. A lot of this conversation has been pointed toward the community participants themselves. What I want to share at this point is also the materials that we're producing are as much for the research community and the organization supporting research as they are for the patient community. Something Mrs. Parker said, which is extremely important. Before you come into the community, you need to know about the community. And what these materials are doing is lifting up the stories from the community, and they're letting you know what's important to the community, what their lived experience is like. And that's extremely important for some researchers, because one of the issues we find when talking to the community is that the researchers are sending material over announcing their research projects or studies or opportunities, and they don't speak to the community. They don't speak in the terms. They don't speak in the what motivates the community. So I want to leave that there, put it in the parking lot for a minute, and then I'll come back because it's not just about the patients or the study subjects themselves. So I've had a very interesting opportunity, and I think this is important. I want to paint a visual landscape for participants or potential participants and their caregivers who are also potential participants in these studies. So first there's a range of research anyway that goes all the way from reviewing clinical reports from hospitals, things like that, looking into data to see what trends there are, things like that, through models, and all the way to when they finally involve human subjects. Many people we talk to only focus on that far end, the human subject, and only the most invasive things. But the landscape is much broader than that. So researchers are coming from a much broader cloth than simply invasive research. Second, given that then, we go to the studies that involve human subjects. And then as Dr. Gilbert has alluded to, the landscape there is also, so we like to call it the journey map, because there's an array of ways to participate. And I'm going to then use myself as an example that go all the way from being an advisor in an advisory capacity. So I'm not the study subject. I'm actually advising the researchers who are developing the protocols, the informed consent documents, the patient-facing material, all the way to becoming a study subject. And then even when you are a study subject, the road is all the way from the most non-invasive, as Denise mentioned, observational studies and survey studies, to more invasive clinical trials involving body fluids draws like a blood draw or DBS, which is the implantation of a medical device. So Dr. Shaw mentioned and said you have to meet the patients where they are. Sometimes we have to break that down, peel the layers off the onions, parse it to find out where people are, because they're unaware of this broad landscape. They're unaware that they can get their toe wet, without giving up body fluid. So a lot of the work we have to do, I can summarize under 3 words: educate, educate, educate. Because we have to clear up some unfortunate misinformation, some unintended misinformation, and just unintended myths that are out there. So in the book, you will find one of my favorite tables is the myth and facts tables. And we have one set for researchers and one set for the community. We got a lot of work to do in this area, but part of it is just clearing up the perceptions and meeting the people where their challenge is and letting them know that we can participate at a level that's comfortable with ourselves. So I am, as I mentioned, on advisory groups. I am on panels setting developing standards. I am a study partner for Denise in nearly all of her studies, and I'll come back to that one because that's very important as I reach out to our caregivers. Um, I am a study partner. I'm not the study subject, but I partner with her, and that becomes an important role. All the way to being the subject myself. And I had to laugh. I don't know if Dr. Gilbert, you knew that I'm one of those who are claustrophobic. So when you mentioned that word, it struck my heart. And in my story in the documentary, I tell that story about being claustrophobic and the kind of accommodations that are needed. Otherwise, I'm excluded. So all the way from sort of send information out, fill out surveys to getting stuck with a needle. There's just a lot of room to participate in clinical trials.
Fantastic. Karen asked a follow-up question. So you've talked a lot about the book. We've shown the cover. How does somebody get this book?
So we will supply you with an email address shortly. Basically, at WPC, we're going to have, little QR codes and the whole bit, which will identify that as we're working through that. We're working through the process. But mainly, if you just send me an email right now, we will keep you up to date, or any of our panelists, on how to get the book. And we will be trying to set up a public dissemination process as soon as possible.
Fantastic. Okay, so we'll share that email address with our participants for sure, and at least in an after broadcast email, we'll definitely include your email, so everyone will have access to that. Charles asks a very good question, and I think, well, I'll leave it open. Possibly Dr. Shah would be a good person to start with this one. If you are fresh to this whole field, how do you start? How do you start looking for research opportunities? What are the steps?
So I would always start by talking to your neurologist or treating physician to ask, are they familiar with research? Now, I recognize that not everyone, neurologist or physician, may be familiar with research. If someone is in the local community, that often isn't where research is taking place. Research is typically being taken place in academic centers. So, for instance, I'm affiliated with Columbia University. There are often urban or, large metro areas that have an academic center where research is being conducted. So that doesn't mean that your clinical care necessarily has to be at that center. You can often participate in research and have your clinical care done locally, or both. So step one would be looking to your local physician who may or may not be familiar with research. After you've done that, there are national databases. So two are clinicaltrials.gov, and then the Michael J. Fox Foundation has their trial finder. These are websites where you can put in information about the disease state you're interested in, whether it's Parkinson's or something else that you may be grappling with. You can include geographic information, and it will tell you what, if any, research is being done locally. But you might also be curious because now in the post-COVID age, there's a lot of virtual studies that are also being done. So you don't necessarily have to even be based where they are. APDA is a wonderful organization that often through its newsletters shares information about research. So for instance, last month, we were partners in a nutrition survey. So this was just something where you fill out 15 questions in the comfort of your own home. So these are different mechanisms, but that would be how I would recommend getting started. But I invite Bernard, Denise, and Ms. Parker to share their insights as well.
Denise, it looks like hands up.
So we found this to be probably one of the biggest gaps of all, and that is the gap between the research community attempting to publicize their information and the potential study subject trying to consume that information or find it. And so this is an excellent question, because I would answer this by saying there's a lot of people suddenly working, not suddenly, but working very hard now to close this gap because it's clearly been identified. So a couple of things are going to be required. Dr. Shaw mentioned several sites, more coming along. They're not always easy. So I ask you to be patient as improvements to those sites come along. Clinicaltrials.gov is not the easiest place to search for, especially if you're technology challenged. But we have books, we have stories in our book telling you how the PD movers got theirs, and it's very interesting. The array of way people find out about studies. But Dr. Shaw touched on a number of them. What we ask you to do is ask a lot of questions, ask around. It's surprising where you learn about them. I will say that some of the most fruitful places, though, are sites being put up by academic institutions or organizations that recognize this gap and are feeding the support group community with information about research because it is a tough gap right now.
Thank you for that. I think Denise, you wanted
My
to add?
easiest way is to talk to the people that you know who have participated in research because they obviously have found a way to find the research. But most importantly is the support groups. I found so many researchers through my support groups. Then I found out that most universities, as Dr. Shaw said, have a list and they will put it out or ask, are you interested? And they will let you know what research is going on there. So I started with locally with my support group, then looked at the universities, and then I looked at the researchers that were coming online for both care partners and for people with Parkinson's. And that's how I kept my fluid line of going from observational to longitudinal and more creative things. And if you tell people what you're looking for, they will come and answer you because they will get in the network. For instance, somebody said, there isn't anything for care partners. And so there was this doctor who got online and let everybody know that she was looking at care partners. And it's become a very big thing for care partners to participate in the research as well.
Fantastic. And I just wanted to highlight that from the physician's point of view, one of the first things that everyone has been saying is, speak to people, speak to your neurologist. If your visit is 20 minutes long and it's taken up by lots of other things, it may not be top of mind for the neurologist. So you may have to say something. It may not be something that is brought up organically. So you have to be very proactive is what I'm hearing. So thank you, Charles, for that question. We have another amazing question. Yeah, go ahead.
If I could, let me interject one last thing. Dr. Google is not the authoritative source on clinical research. I have to say this because we hear this in so many support groups. And what's important there is that you need to take a certain amount of time to understand what we were talking about, the landscape of clinical research, so that you can be discriminating in what you learn from social media. Because we can't control social media. There's no certification that what's thrown up there as a clinical trial is. So you need to learn a little, educate yourself a little bit about where the certified, where the validated clinical research is, and not just jump on it because it sounded good from Dr. Google or Dr. Facebook or Dr. whatever. Okay.
Excellent, excellent point. Thank you for highlighting that. I want to get to Claudia's question because I think this is really the crux of the issue. So I'm going to read it. My name is Claudia. I'm a neuroscience researcher. I'm wondering how I can best engage with the community, both to better understand and relate with to those with Parkinson's, as well as build connections for recruitment purposes. So this is a question that probably everyone has something to say about. Let's start with Ms. Parker. What do you advise Claudia on how to start when you want to engage in any particular community, but we can talk about the community that you're familiar with?
Being involved in the community first, and they know you, and you come out through health fairs, just being present. Your presence make a difference. What I've seen, education, as Bernard said, is very important in the beginning. If you're coming out doing some type of educational health fair, doing a tabling. They'll come up to you and ask you a question and how you respond to them, and they may invite you to leave your card. What I find the most about that, it takes time for people to want to reach out outside of their normal area. And we do a lot of community outreach at my church. But it took some of our members who were doing the outreach with us over 3 years to go and have a second opinion and get involved in some research. So it takes time. It's not, but you have to be present in the community where the people who are underserved are. And that's my passion, the community and getting them into care.
Anyone want to?
Hispanic and Black.
Yeah, I would echo that. I know that, just as someone, first of all, Claudia, I want to applaud you for asking the question. I think the fact that you're asking indicates that you're aware that this is a step that you need to take. So I think that's really wonderful. This first thing I would say to you is be patient, and also try to remember that it will take time. So even if you spend some time in the community, that if it doesn't suddenly, result in a change in your recruitment, it doesn't mean you're doing anything wrong. It just means that it simply takes time. For me, when I was working in the church, I still can remember those early days of doing brain health seminars and the body language of the individuals being more closed off. They were being quiet. They were certainly respectful and said hello to me, but I knew they were there because Miss Parker asked them to attend, not because they saw that Dr. Shaw was coming to give a presentation on X, Y, and Z. But years later now, when I go to the church, I am welcomed with open arms, big smiles, hugs, and people are asking me that, could you tell me what should I do about this? And I think that implies that trust was built. And so I think being in the community, being recognized, becoming familiar, building those relationships. And I would also just remind you, start with what can you give without asking what your ask is. That, being curious about, well, what do you need? What information or resources is your community feeling that they're missing? How can I help build those connections or bridges? Like, oh, your community is curious about falls prevention. I can find a physical therapist and speak about that, or we'll teach you about, how to prevent falls. It may not be something that you're directly doing research on, but once those foundation and those ties are built, and as people learn more about Parkinson's, that's what we observed is that, we started with brain health and then we started to talk about Parkinson's. And then people were asking us, well, don't they want to check the spinal fluid? Like, don't they want to do this? And I'm like, actually, yes, they do. And then so let's talk about it. And organically, people started to ask about research and wanting to learn more. But I think it's only after that trust is built where people think that you're reliable, that you're going to come back, that you're not just going to come in once and disappear. Because frankly, the community also has seen that and they've been there, which is why it's a part of the reason that there's this hesitancy. It's not the whole story. But again, that's where the book can help you because there's so many different pieces of this pie of what makes it difficult, and we can't address all of it at once. But I think piece by piece, it can be addressed. And it starts with that desire, wanting to be in the community and understand them. So thanks for the question.
We are amazingly. Oh, Bernard, you wanted to add?
So one last thing I'll add for this, and that is, Dr. Alvarez, there are people working on this from the community side, and we're developing what we call safe spaces. And so if you think about the health fair as a safe space, it's the community has put, the particular community member has put their credibility on the line, created this space, which you see as the health fair, and that is a place where people can then come and feel comfortable asking the questions. But the key here is that you don't have to do everything yourself. If you think about it more from a collaborative standpoint, and think of meeting people where they are is going to where someone else has established a safe space for you. It may be a community center. It may be the senior center. In fact, often now it is. It's a senior center. It's a community center. It's a place where somebody else has built trust. And then you go in as an invited guest. And as Dr. Shaw was mentioning, take the time, Mrs. Parker and Dr. Shaw, take the time to first be present, wait your turn, come willing to share something, and then allow them to come to you instead of everybody trying to build it themselves, because it takes a long time and it's a lot of effort. Start looking for where you can collaborate with existing structures within the underengaged communities.
Thank you. And Denise.
Right. There have been some very creative ways as well. And this is one from Colombia and some other ones. There was one person who would have a tent at the New York fairs, and she was a doctor. Didn't really portray that she was there as a doctor in the beginning because she had a white coat. Then she realized she needed to get rid of the white coat and then have conversations. Then people gained trust because she was always there. The same thing with some of the communities. There are community centers that will host and say, we're going to have something on Parkinson's or something on mental health. And you can go there and the researchers, and they will talk to you or they will show you where they are. And then there are certain hospitals and universities that have events on a regular basis. But one of the fun ways to pick a place to go to is go to the walks, because most of the cities have some walks somewhere close by. And at those walks, there are tables of researchers and people who are talking about Parkinson's and establishing that trust. Then you can follow in as opposed to creating your own venue to do it. And I see Dr. Shaw has her hand up.
Oh, sorry, Rebecca, I'll be brief. Just to piggyback on what Bernard and everyone was saying, just another reminder is like to try to think about where people are already gathering. So there may be, as he said, a support group, a senior center, but there may be other community or places. So for instance, in our community, there's a bookshop, and they often hold seminars or educational sessions, the library. So maybe thinking about spaces where the demographic or the group that you're trying to reach already gathers. And then, as Ms. Parker pointed out, get to know that community. So if it's the bookshop, if it's a senior center, take a look at what's on their agenda. What are their priorities? You know, how can you align with what they're already identifying is important to them rather than trying to push or, you know, build in the connection for recruitment, but starting with what is it that this organization wants and really spending some time learning and understanding that group and then building from there. But I'm sure you're going to be so successful, and we'll probably hear about your work with Dr. Gilbert next year.
Fantastic. We are at the end, almost at the end of our hour, and I wanted to get one more concept in, which I know is near and dear to Bernard's heart, and I think it ties very well into what we were just talking about, giving Claudia some great ideas, and that are plain language summaries, translating research into material that regular people who are not yet involved in research would be able to understand. So Bernard, could you elaborate on that and the importance of that?
Thank you.
One minute
that
or
up.
less. No, just kidding.
Thank you for teeing that up. It's really important that people don't assume that plain language means less than. That plain language means that you're giving up scientific accuracy. What plain language is about is effectively communicating with people so that they understand the material that's coming to them. It does no good if you have the scientific gold in your document if nobody understands it except another physician. It's just not there. So near and dear to my heart, and you're starting to see it now, is work on patient-facing materials, emphasizing using plain language, not showing your scientific, all your degrees and stuff, but mainly focus on what is it that we need to communicate, and let's do it in a language that's for the community that it's being aimed at. So plain language doesn't mean you reduce it. What it means is you mean it's clear, that you use words that are familiar to the community where they are, and you can maintain the accuracy. at the
Fantastic.
same time. So
And I wanted to add one perspective from the a physician side. Sometimes you'll write something that you think is plain language because you're so familiar with a term. And so it's so crucial to get that person with Parkinson's perspective to say, you know, that is something that will need to be said in a different way. And so it cannot be emphasized enough that there's that some of these materials that seem to not be well versed for people with Parkinson's is because they weren't run by a person with Parkinson's. So I think that's really, really crucial. Denise.
One quick thing, along with plain language, having plain diagrams of words that are not familiar to people in the field. CSF, who knows what that is?
That's
Have
a
a
good
picture
example.
or a video, and all the other terms that may not be something that is familiar with a layperson, to put it in video or pictures is worth 1,000 words.
Absolutely fantastic. So on that note, we are going to wrap up. I wanted to thank our audience for listening to all this fantastic information, for asking fabulous questions. And I want to thank my 4 guests for joining us today and giving us all your amazing insights. You're going to be receiving a post-event email. It's going to contain a link to a survey. It's also going to contain Bernard's email address that you can email him about the book. I'd like you to fill out that survey. Let us know your thoughts on today's program, and with your input, we can design additional programming for you. Now, if you know someone who missed today's program, if you joined late, and if you'd like to watch this again, this recording will be available later on our YouTube channel. And when you're there, don't forget to subscribe to our YouTube channel, and you can watch all our videos and all our live broadcasts. I want to alert our audience that we have 2 exciting upcoming programs. So on June 2nd, APDA will be broadcasting a new episode of our long-standing physical therapy series called Let's Keep Moving. And the episode is entitled Staying on Your Feet, Pushing the Boundaries of Balance. And on June 9th, we'll present the next episode of our occupational theory series, which is entitled Everyday Energy Strategy. So we hope you can join us for those 2 episodes. For additional information and resources, please visit our website at apdaparkinson.org. And on our homepage, please make sure to view our new impactful public service announcement, whose message is continue doing what you love to do, even if you have to do it differently. So we hope that PSA will inspire you. Stick around for a few final messages. Before I go, I want to thank you so much for joining us today, and we hope to see you soon on another APDA program. Have a great afternoon.
I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity.